You're listening to Beyond Wellness Radio, bringing you the cutting edge in health, biohacking, and sports performance. Stay up to date and listen anywhere and anytime on your computer, tablet, or smartphone by subscribing on iTunes. Catch your host, Dr. Justin Marcagiani, as he answers your burning health questions as well as interviews from world-renowned guest experts. For more Beyond Wellness Radio, go to beyondwellnessradio.com.
Hey there, it's Dr. Justin Marcagiani. Welcome to Beyond Wellness Radio. Feel free and head over to beyondwellnessradio.com where you can access our full podcast transcriptions. While you're there, you can also sign up for our thyroid and female hormone video series. This series goes into the root cause of why your hormones are out of balance. While you're there, you can also schedule a functional medicine consult with Dr. Justin, myself, where we'll dig deeper into the root cause of your health challenges. Feel free and think of sharing this podcast with at least one person. This podcast grows by people sharing it. Sharing is caring. If you can think of one person that can benefit from this information, please feel free and share it. If you're enjoying the podcast, make sure you subscribe on iTunes. You can also click below the video or podcast where you'll see the iTunes review button and leave us a review. You can also sign up for the newsletter at beyondwellnessradio.com where you'll get updates before anyone else. Thank you so much and enjoy the show. Hey guys, it's Dr. Justin Marcagiani here. Welcome back to the show. We have Dr. Joan Sefcik, my personal dentist, on the show today. Dr. Joan, it's great to be here. How you doing?
Great. Thanks for having me.
Excellent. And we're going to go into just kind of the top major issues that people are seeing dentists for. We're going to compare and contrast some of the conventional, dentist procedures, and we're going to talk about some of the more holistic things. We're going to talk about some of the do's, the don'ts, root canals, fluoride, cavities. We're going to go into it. And if anyone wants to reach out to Dr. Joan, she's over here in Austin, Texas. Go to austindentalwellness.com, austindentalwellness.com. We'll put her link down below if you want to reach out. She sees patients as well. So Dr. Joan, let's dig in. What's the biggest myth out there that you kind of want to highlight that you're having people come to see you with on the conventional side, and they're having a health issue, they're having a concern? What's that biggest myth that you're typically dispelling on a daily basis?
I guess that what's in the mouth doesn't affect the rest of the body. Because it does, because it's not separate from the rest of the body.
Totally.
Everything, what's in it, what's going on in there affects everything else in your health.
So there's a massive connection between the mouth, the gut, obviously the heart as well. We know like dental health issues can easily, have a major connection with cardiovascular disease as well. Inflammation in the gums could be a manifestation of inflammation in the body, right?
And there's also energetic connections because each tooth actually goes
the meridians, right?
Body. Yes. Mm-hmm.
So do you notice that correlation if someone has like a root canal or some kind of inflammation in a certain nerve root that connects with maybe the heart meridian or the breast meridian? Do you notice connections with that, people?
Oh, all the time. And even metal in that tooth can short circuit that meridian.
Oh, wow.
I agree. Mm-hmm.
Very cool. Now because we talked about health in the mouth, how important is it diet? Because I remember how important is diet to having healthy dental health? I remember we chatted one time that a lot of people, they're just not getting enough vitamin K2 or enough various nutrients or amino acids to build back that tooth, build back the enamel. How important do you see the diet and the nutrients coming in to actual dental health?
It's very important because the tooth is a live organism, unless you've had a root canal, which is a dead tooth. But it's being fed all the time. So you need your fat-soluble vitamins, your D, your A vitamins, your K2, and you need to watch your refined sugars, because once you eating sugars not only can cause plaque buildup, but there's a flow that goes from the tooth from the inside out, so it flushes the tubules in the tooth, and when you eat sugar, it actually reverses that flow, so all the gunk that's in your mouth starts going into the tooth and damaging.
Oh, wow.
The tooth.
And how many people, what's the percentage of dentists that are out there that actually understand that strong diet connection and are actually educating their patients and cutting the sugar out and getting the fat soluble nutrients and getting the collagen and the good glandulars? What percent you think?
Not many.
Yeah.
I'd be generous at 20%.
And I imagine a lot of the educational information that you've gotten over the years, was that part of your dental curriculum when you were in school, or was that things that you kind of read or got outside of the curriculum?
No, not at all. This is all learned after school.
I think that's probably the big thing is a lot of a lot of dentists and medical doctors, they kind of have this arrogance that, oh, if it wasn't taught in school, then it can't be important. So then as they go out in the field and they're seeing patients, they hear information and they kind of have a filter up like, oh, that wasn't taught to me in school, so it can't be important. And they kind of just block out all this extra information. So what separated you from others, from putting out your hands and blocking it versus being receptive and taking it in and then applying it with your patients?
Well, I've always been kind of a rebel, so I think that helps. But I did have a boyfriend who came down with cancer years ago.
I remember this, yeah.
And that motivated me to search all alternative healing methods. And at the same time, there was an MD in town that was doing chelation and took me to lunch. And it was right before that, and he started talking about mercury. And he actually gave me a chart of the meridian chart of the teeth. And this is before internet. So I looked at the bottom of the chart and I saw it was the International Academy of Biological Dentistry and Medicine. It was the Academy of Biological Dentistry back then, and called and went to the course and started just learning. We just had to go seek out courses and find books. And
you were the former president of the IAOMT.org, right?
No, IABDM.
Okay, got it. And how are they different?
I think IABDM is the original biological dentistry group, and they're
is that by Hal Huggins?
Hal Huggins was part of it too. IABDM has always understood the energetic connections between the teeth, and they've always been very against the root canals because they understand how they affect the rest of the body. But both organizations are anti-mercury, anti-fluoride, and IOMT is coming along with the root canals too now because they're seeing the research. Because
I think I found you via IAOMT like 5 years ago, so I know I saw you.
Yeah.
Okay. Perfect. Now, I'm just curious, right? We have cavities, and then we have the ability to regenerate. And I had Dr. Stephen Lin on the podcast last month, and we talked about, how long do you wait for a cavity to kind of continue to regress and get worse before you fill it? How much leeway does the body have to heal and recover? And at what point do you say, oh, it may be time to fill it?
It depends how far it's gotten into that dentin layer. You have the outside part of the tooth, which is like the enamel, which is the hardest substance of your whole body. And then you have the dentin, which is a little softer, and it's full of these little tubules. Mm-hmm. So the problem with the bacteria can get through these tubules and get to the nerve faster. It can hide out in there. It depends how far into the dentin that it can repair itself.
Yeah, I think Dr. Stephen Lin said once it's through the enamel and it's about halfway through the dentin, that's where he typically will start to fill. He said he's seen a lot of teeth. If it doesn't go halfway through the dentin, he says there is an ability to recover. You really have to up the vitamin A, D, E, and K, and then really get good amino acids and minerals on board. Would you say that's about right?
Exactly, and I can hit it with ozone. I use a lot of ozone in the practice, so that helps
that's great.
Kill the bacterial factor in it. So.
Oh, that's great. And so with a lot of patients that you're seeing, there may be a lot of dentists that are really trigger happy to fill it, but you may watch it a little bit longer and see if it continues to regress versus, give it a little bit more time to heal and make maybe some diet and lifestyle changes. Exactly.
I'm fairly conservative, but you have to be really on it. And if, you have to kind of see how the patient is with their diet and, if they're going to still be sneaking the cookies in all the time.
Right. So you're looking, you're saying, hey, what's your diet? Are you open to making these changes? And if they're like, probably not, then you may, be a little bit more realistic in your approach.
Yes. Because I'm not a big fan of fluoride at all either.
Oh, that's great. We're going to go right into that next. So, and then let's just go into the materials that you're using. So of course, in the past, there was mercury amalgam, which people kind of use silver is the slang term, but it's really over 50% mercury. So it's kind of it's a little disingenuous calling it silver when it's really mercury. So that's kind of still used by some dentists, more kind of progressing. What are the sources of filling that you're using?
I use a non-BPA composite and some biocompatible composites and some biocompatible porcelains.
That's great. And then do you find that those they don't affect the nervous system as much? Because I know the metal right being next to your brain can have some effects. So you find those do really well from a meridian standpoint?
Oh, exactly. I actually, if I'm going to take some mercury fillings out, I follow Dr. Huggins' protocol. We actually check the charges of each filling, and we take the quadrant, the ones that have the highest charge out first, because it keeps your body in parasympathetic, it keeps you calm and relaxed. Because each of them has a charge, and the saliva acts kind of like water in a battery. You
Yeah.
get this whole charge going on your head, and you want to gently get rid of those so you don't cause too much disruption to the body.
And I remember when I had not a root canal, but I had a crown, we took some of the top 3 to 5 materials that you liked, and we muscle tested, we put it under the mouth, let it sit in the saliva for a bit, and then you muscle tested. And I think it was the zirconia material for the crown tested the best.
Yes, it's fairly biocompatible. Every once in a while, you're going to get someone who isn't compatible with something,
And do you do any of the Clifford testing at all for the compatibility too?
Yes, I do, and I do. There's another one. I do that one too.
And then how does it correlate with the Clifford versus some of the kinesiological testing that you do, where you put it in the mouth and let it sit too?
I mean, I can always do. I can muscle test anytime, but I like the Biocomp a little better because Clifford is suitable and non-suitable. Biocomp is most reactive, moderate reactive, and least reactive. So it has a 3-stage instead of a 2-stage.
Got it. And you find that the composite BPA-free fillers are kind of like your go-to outside of mercury now?
Yes, and there's some that are better than others. So I've seen from the compatibility charts which ones are the best. So I generally use those.
Very cool. And when I go in for my teeth cleanings every 6 months, a couple things I notice is, number one, you're not using fluoride in your office. And I know you use some essential oils and ozone and such when I get my teeth cleaned. Can you talk more about fluoride and why you're against it?
Well, fluoride doesn't exist anywhere naturally in the body. It's not essential for life, and you don't need it for anything. So it's actually a toxin. So your teeth aren't made of fluoride. They're made of calcium, phosphorus, oxygen, and hydrogen. There's no fluoride in your teeth. People think that there's fluoride naturally in your teeth, and there's not. Right. And that those 4 minerals make this perfect hydroxyapatite molecule, and they link up, and it's this beautiful crystalline structure. Well, when you put fluoride in there, which people tend to make your teeth stronger, it pulls out one of the OH ions and makes fluorapatite, which is kind of a deformed crystal. So the teeth don't actually, they may be stronger. Actually, the top surface of strength, that it's only 1/10 of a width of a hair, that it strengthens it. So when a dentist is poking around and probing, it feels strong on the top, but it's not that perfect interlocking crystalline structure the way God intended it to be.
Right.
So you have these little micro cracks in it. So bacteria can still get down there, and what you get is called hidden cavities. So the top may be hard, but you can get this cavity underneath, and you don't notice it till it's huge and the top surface breaks through usually.
Interesting. And a lot of people don't understand that, a lot of the fluoride that exists in nature is like calcium fluoride, and a lot of the fluoride that they're putting in with toothpaste and such is hydrofluorosilicic acid, which is, a byproduct of other types of, fertilizer or bomb industries and such. People aren't aware of that. And also, I think the second thing people aren't aware of is the number one cause of cavities in 10 to 14-year-old kids is dental fluorosis, meaning an overdose of fluoride. Any thoughts on that?
Oh, you see those little white spots? That's from that odd that structure being deformed in the tooth. And it's they said 41% of the kids have it now from drinking the fluoride in the water, which they say eliminates cavities, but none of the studies really show that it decreases decay. Areas that are non-fluoridated and fluoridated don't have any difference in decay rates.
Exactly. And then there's a study over in the UK, I think 2 years ago, that came out where they saw that the people that had consumed the highest amount of fluoride water had the highest risk of hypothyroidism. And I guess the main mechanism is that fluoride's in that halide grouping can pinch hit for iodine. Yeah,
you could replace chlorine, boron, and bromide, and boron too. That's why a lot of arthritis with the fluoride. And it ruins your thyroid, ruins your brain cells. There's like 42 studies saying it causes neurological damage. It's horrible for your body.
Oh yeah. I mean, in university, we had to take, in doctorate school, we had to take a public health course, and we did like 15-hour deep dive into fluoride. And we went through all of the major studies. And I mean, just go type in fluoride and low IQ. You're talking about a 5 to 10 point drop in IQ with just the fluoride consumption. And that's scientifically proven. And the other issue too is, if you were to prescribe someone fluoride, you'd have to pull out your prescription pad and write them a prescription, yet it's in the water. And you can drink as much water as you want. So that's kind of like a medication that's really not being dosed according to each individual. It's like an informed consent issue.
And it's not even FDA approved.
Right, right. And then again, like for anyone listening too, just go look at your typical Crest or Colgate toothpaste. Go look on the back and see what it says. It's going to say a pea size of toothpaste. Number one, who has a pea size? The commercials, or they like lather it on. And then number two, it says if you swallow it, call poison control.
And do you know 1 tube of toothpaste can kill a 9-year-old kid if they
One
ate
tube?
it?
Oh, really?
Yeah.
Unbelievable.
Yeah.
So number one, I like the fact that you're educated on the fluoride. I think most dentists aren't. Number two, you use essential oils and other natural herbs and various compounds, xylitol, et cetera, to help improve dental health. Number three, you're making the diet changes. You understand the minerals that have to go into the teeth. You understand, the work of Weston A. Price, which we can, you've kind of already alluded to that anyway, which is indigenous, fat soluble vitamins, nutrients, and then keeping all the refined foods out. Anything else you wanted to comment on that?
Yeah, Weston Price, we call him the father of biological dentistry because of the nutrition thing, and he's big on the root canals too.
Well, that's a perfect segue. Let's chat about that. Who needs a root canal and who doesn't? Because this is the tough thing. I get patients come in all the time. It's like, when could someone get away with the root canal? And then if they didn't do a root canal, would you recommend an extraction and an implant? How would you do that? So like, when would you recommend a bridge, an implant, a root canal? Can you go through those scenarios? Okay,
so you need a root canal when the tooth has either been killed from trauma, its blood supply's been gone, or decay's gotten into the nerve of the tooth and infected the nerve. So once it dies, it gets in an irreversible part. It's beyond the point of no return. Because actually, people will try to do the herbs and do this and that, but if the tooth's dead, it's actually just as bad as having a root canal. Dr. Huggins has some DNA lab where you can actually send the tooth in and see what bacteria are in it, which is pretty scary. And I've done actually dead teeth that have died from trauma, and they have the same bacteria as root canals.
Wow. So a dead tooth.
A dead tooth from trauma, like someone has a dark tooth in front because they fell 10 years ago, that can be just as toxic as
that could be a big harboring area for all these infections.
Well, it's a burden on your immune system. So if you're fairly healthy and you're not fighting anything, have any issues, your body can probably take care of a root canal or maybe two. If you're ill in any way, cancer, autoimmune problems, I would get them out because they're just they harbor all these bacteria. They're an energetic blockage on that meridian.
Got it.
And they those little tubules that I was talking about in the dentin.
Yeah.
When you take the nerve out, normally when the nerve's in there, it's flushing those fluids out. When you take the nerve out, it's dry. So nothing's flushing those little tubules. If you take those little tubules in the dentin in one tooth and stand them end to end, it's about 3 miles per tooth. So they're tiny, but bacteria can still go in there and hang out. So they set up house. They're like, hey, the blood supply, nothing can get to me. Antibiotics can't get to me because there's no more blood supply. So they sit there and multiply and mutate and spill up toxins. But every time you chew, you squeeze them out into your body because you're applying pressure. But your body can't get into it because there's no more blood supply. So, they go to your weak organs or, it just spills out and can wreak havoc.
So can you describe the actual root canal procedure for most people? Some people, they've heard of it, but what does the procedure consist of?
So you actually will go through the top of the tooth because each root has a canal in the middle.
Mm-hmm.
So you go to the top of the tooth and you take these files and you clean it out, disinfect it. But all the teeth just don't have one canal. There's accessory canals that come off the side.
Got it.
And not only are those little dental tubules, but you have little extra accessory canals that you can't really clean out. So those basically never really get cleaned out. And then
that's the problem is you're drilling in there, but it's the accessory canals you're probably not going to be able to get because you'd have to drill in all kinds of directions and destroy the tooth, right?
And you can't see them hardly. It's and you don't know which way they're going. They can tree off like a delta, of a river. It's crazy.
So is there ever a scenario where you would recommend a root canal?
You have to, if someone has their one tooth on a huge bridge and that's holding you have to take the, patient by patient into consideration and how healthy they are and how, if anyone has cancer, I would definitely get all your root canals out because they actually root canals emit a toxin that inhibit a gene that kills cancer cells.
Oh, wow.
So I would definitely get them out if I had cancer.
So what's the scenario where you would recommend or you'd be okay with a root canal? Someone's healthy, and then what? Like, what areas of the mouth would it have to be on?
I actually quit doing them because I can't ethically do them myself anymore. I will inform the patient that that's an option and it's up to them, and give them all the pros and cons and what I know, but.
So if it was you, right, let's say, you're a healthy individual, right? Would you personally get one done yourself?
No.
Okay. So in general, you probably wouldn't recommend it. So what would be the alternative?
Is to take the tooth out, and you want a biological dentist to take the tooth out because you want all the dead bone and infection cleaned out so that the area heals and the energy flows through there properly.
So this is great. I want to highlight one thing. So just compare. So if you're going to extract the tooth, how would you do it differently than a conventional dentist? What kind of precautions would you take?
I actually probably spend more time cleaning the socket out than taking the tooth out. Most of the time. I will drill a little out. I have extra special bone files I've gotten. I clean out and I make sure I feel good bone. I clean all the infection out because the infection goes out into the surrounding bone, and it's usually soft and you can feel it. And I scrape it out, clean it out. I use ozone. I use ozonated water. We use colloidal silver,
So basically you're spending more time on the cleaning process. You're spending more time using natural compounds to get everything kind of sanitary in there. And then is there anything else you're doing? Is there like a dental dam that goes in place? Is there any extra precautions that are made to make sure that debris doesn't go down the person's mouth?
No, I never use epinephrine in my anesthesia. That can cause a cavitation. Never. Biological dentists usually never use epinephrine in their anesthesia.
And what's a cavitation?
Cavitation is an area that had an extraction, and either because of the epinephrine, because it kills bone cells, or because of not cleaning out the area completely and it encapsulated around it, or if a patient has some clotting issues, if they hyperclot or hypoclotting, it just didn't heal right. So if you had a dry socket, chances are you probably had you have a cavitation there. They say almost 80% of the wisdom teeth have cavitations. So the bone heals over. It's a hole in the bone, and it's full of bacteria. It's septic. You can go in there and clean them out, and I've actually sometimes gotten green globs out of there, or black tarry stuff. It's amazing.
Wow.
It comes out of in the wisdom teeth areas, and those energetically go to the heart and the small intestine.
Oh
so
my God.
Anyone with heart problems or SIBO, actually, I think SIBO is a good place to look for in the wisdom teeth areas.
And how are you assessing the cavitations? Are you doing the cone beam testing? Can you visually see?
You can do that. You can usually visually see them on an X-ray. I've been doing it for long enough. You can tell.
And then basically the solution for that, the cause is the epinephrine during the extraction, but you're going to go in there, you're going to open it up, you're going to clean it better, make sure any dead debris is out, sanitize it, and then what precautions are you going to make so it doesn't happen again? I
try to make sure you have you sew it up so it's closed up so it will heal. So there's no chance of the clot coming out again. And usually that's easier to do because it's already closed. You can get primary closure because usually going in a new area. When I do extraction, it's a little harder. So I usually do suture and make sure everything's closed up.
Got it. So for you, because you've done this so long, you don't need a cone beam. But a lot of people that maybe are inexperienced, they would need a cone beam.
You can. You can do a cone beam too. You can feel around. You can feel it in there. Cone beams are great because you can tell right away.
Got it. And so let's continue to talk about the extraction. So you extract it, and then you're gonna basically put a dental implant in. That would be your overall solution for a root canal. Is that correct?
Yes, you can leave the space, but teeth may move.
Yep.
You could do a little removable, which are made of real biocompatible little nylon. You can do a little one tooth removable if there's a tooth behind it. And that's a real biocompatible replacement because it doesn't do anything to the other teeth. You can do a bridge, but you have to crown the teeth on either side. Or you can do an implant. If you do an implant, I would only do a ceramic one or zirconia one, not a titanium one, because that metal short circuits the meridian of the titanium.
Totally. All right. So you do this extraction, you do the implant, you're choosing biologically compatible material, you're cleaning things out really well, you're taking extra bit of time to make sure all the dead debris, all that's knocked out. When would you do a bridge versus an extraction? Can you compare those two, and why would you do one over the other?
You need a bridge after an extraction.
So can you talk about the difference?
Bridge is, say you have a tooth missing between two other teeth.
Yeah.
So you actually crown the teeth on either side, and then there's a dummy tooth in the middle, and it's glued in permanently. So it's like two crowns with the tooth in the middle, and then that's glued in permanently.
So with an extraction, you wouldn't just screw it right into the bone and it would stay. It would have to anchor to the teeth left and right of it.
Yeah, right into the bone is the implant. So the implant goes right into the bone by itself, and that's process. It has to integrate into the bone. And I would also do a biocompatibility test to make sure you're compatible with the zirconia, because I had had a patient that wasn't compatible. And we found out later he was rejecting his implants, and that's why.
Got it. So I want to make sure everyone understands this. So we have the implant, we extract it, we pull out the bad tooth, we clean it really well, we implant that tooth in there, and then every time there's an implant, there's always going to be a bridge to anchor it in. No.
You either have a removable that you take in and out. That's one way. The bridge is another way, but you crown the teeth on either side and glue it in.
Got it.
With the missing tooth. Or you can do an implant. So the implant goes into the bone. Now, Huggins, some say an implant is still a foreign object in your bone. So it can create some autoimmune reaction. And some people, Dr. Huggins used to say, it could be tomorrow, it could be 100 years from now. But, because your spleen might be a little stimulated constantly because it's going, what's that? But, some people have no problem at all with them. And I said,
which option would you recommend?
Depends on the person,
So can you compare and contrast an implant versus a bridge? Who would be the better candidate for which?
I mean, if you have perfectly untouched teeth on either side and you don't want them crowned, then you might want to go for an implant. Because if you already have crowns on either side or big fillings and they could use crowns already, then it's not that,
Got it.
On what, how much, and if you want to not touch any, a little removable, and which is the least expensive route to go anyway, is the way to go.
And how would that anchor in? Would that be like a retainer kind of thing?
It has little clasps that hook on the teeth on either side, and it snaps in.
Got it. So what I'm hearing is like kind of the more your teeth are already maybe have less integrity from previous fillings or previous crowns, then it may make sense to go with the bridge. Yeah,
and everyone has this. Some people love the little removable, some people hate them. So then if they hate them, they'll get a bridge or they'll do something else. It's everyone's has their own different.
Perfect. And what other procedures are we missing here? So we went over the root canal, because I get this all the time. So we went over all the options there. Is there any other common procedures that just like there's a vast difference in what the conventional method is versus kind of more the holistic method? Anything else you want to add there?
Well, if we remove any mercury in the mouth, we take extreme precautions to protect the patient.
Let's talk about that.
So if we're going to remove any mercury, we will, of course, numb the patient up and then place a rubber dam, seal that dam up, cover up the patient, put them on oxygen. We wear a gas mask. The assistant wears a gas mask, and then we take it. When we're done, we use the special vacuums and water and special suction. And after we're done, I actually take everything. We have the patient rinse with charcoal and take some charcoal. And I take everything, I literally put it outside. I take all the patient's all covered up, we're all covered up, and I throw everything outside.
That's great. Are you doing any chelation compounds outside of the binders? Are you doing any DMPS or DMSA or EDTA along with that?
No, I usually leave that up to the other physicians.
Perfect. And then do you prepare it all like a couple days ahead of time? Do you recommend like any glutathione, or are you just working with someone else that's helping with that?
Well, we do give them some lipospheric C afterwards, and we have glutathione too in the office, and I do glutathione right after.
Oh, that's good.
Yeah.
And when I do a patient history, I mean, I see so many patients that they have the right thought process, like, oh, I have all these heavy metal fillings, I should get them removed. But then they go and they see an untrained dentist and they just do it the wrong way. And it's so sad because number one, the extraction method, you know, if you're not using the cold water pick, if you don't have the dental dam, if you don't have your own patient supply of oxygen, your chance of getting toxic is really high. And then it's even worse for the doctor because the doctor is going through a lot more of these procedures than the patient, and they don't have their own oxygen either. And I think that's part of the reason why I think, what was it? I think the dental profession had the highest suicide rate out of any profession. I think maybe the heavy metals could be a part of that. What do you think?
Oh, I'm sure. And also there's a high infertility rate between female dentists and assistants too, because of the mercury. They're doing studies on it now. But oh yeah, if you just get your mercury removed without any of the precautions, you have huge exposure to it. Huge, because the vapor itself, inhaling it, the vapor itself, plus not only that getting under your tongue and absorbing under your tongue and everywhere else it's not good.
Yeah, we'll put a video in the show notes. It's called The Smoking Tooth by Dr. Kennedy. And he talks about just the simple, you know, drinking a coffee, brushing your teeth, just simple daily activities. You can see with the fluoroscope that the mercury vapor is coming off. And, you know, you add a drill in there and you don't have all these other precautions like you're adding in. I mean, you're going to get yourself, you know, way more toxic. So that's good that you're making a whole bunch of other changes that other doctors aren't.
Yeah, that's a great video.
Yeah, it's a really good one.
It even freaked all of us out. And we knew it already.
Right? Yeah, totally. What other common procedures you want to highlight that for the individuals watching that, you know, they may encounter in the conventional side that may not be adequately addressed?
Well, we got extractions, right?
You need extractions, root canals,
fluoride, mercury, energetic issues, I guess. You know, there's energetic issues in the mouth.
So I guess someone that may have had a previous root canal, you know, you didn't see them, they're coming to you with some health issues. They may have had some root canals. How would you assess if they need to have their root canals removed?
I'd say, especially women, if they have any breast cancer history, because a lot of the teeth go energetically to the breast. And that's a factor, especially if they have an abscess tooth. And I ask them, you know, when they're trying to make their decision, what's the history of breast cancer in your family? Because that tooth is on a breast meridian, just so you know. And that could be a factor in. And I've seen, I'd say probably all but 2 patients I've had that have breast cancer had root canals on their breast meridian teeth. And the other 2 had issues with those teeth that weren't root canals, but they had periodontal issues around those teeth. So it's very common to have to see it in cancer patients, the root canals.
Totally. Makes so much sense. Is there anything else you want to share with the listeners? Do you have a favorite brand of like toothpaste or a favorite kind of like, you know, toothbrush? I know there's like, you know, there's like the electric ones, the conventional ones, any items that you use for oral hygiene that you want to highlight that you think are the best?
Well, I use a lot of, I kind of have my spread of toothpaste. So I use anything from the charcoal ones, the you know,
neem or xylitol,
or the thieves ones, or
yep.
You know, there's some with silver now. I think anything that's natural without fluoride. Do not give your kids fluoride. Don't give your kids fluoride toothpaste, and don't give them fluoridated drinking water. Do you know if you make baby formula with fluoridated water, the baby gets 400 times the amount of fluoride per kilogram weight than an adult?
Totally makes sense. I mean,
and yeah, you're ruining the brain and everything.
100%. Yeah, my house, we have a full house water filter that's carbon based, and then we have a reverse osmosis that everything comes to the countertop, and then we have a trace mineral support that will add a little squirt into our drinking water to get those extra minerals back in. But, you know, 100%, if you're a woman and you're breastfeeding and you're drinking tap water or fluoridated water, that fluoride is going to pass into the breast milk, and there's research showing that low IQ. So if you want your kid to reach its maximal potential, we want to make sure that that's out of there for sure.
Yeah, for sure. Anything that's non-fluoridated is good, you know.
Perfect. I'm a big fan. I like the Xylowhite. I use the Cinefresh. I like that one. It's fluoride free. It's got some, you know, Maluka, not Maluka, but the tea tree oil. It's got the papain, some of the baking soda. That's a really nice one. I like that.
Yeah, that's a good one.
Awesome. So if people are listening and they're like, you know what, I live in another part of the country and, would you be able to do a phone consult with people to review their history, maybe review x-rays to kind of make recommendations on procedures or referrals? Is that something you do?
I can, sure.
Great. So we'll put your link down below, austindentalwellness.com. So if you need to get a history evaluation, you want to figure out treatment options, you want to get referrals to doctors in your area, feel free and schedule a consult with Dr. Joan. Also, if you're in the Austin area at all, I mean, I know people that travel, far and wide. We had Kieran just come up from Costa Rica to come see you from another continent. So that's pretty cool. So feel free and check Dr. Joan out. She's my personal dentist. She is great. I'm really happy that she's on the show here, really sharing this great information. And also the fact that you have this knowledge on the nutrition aspect and you're combining that in and you're really trying to let the person's own body be able to heal it and try to work with that, I think is phenomenal.
That's great. Yeah, eat your butter. They say 2 pats a day keep the cavities away.
I love it. Is there anything else you want to add? Any other like common myths or common questions that you get a lot that you want to dispel here?
Not that I can think of right offhand.
Perfect. Well, we went over some amazing stuff. Cavities, cavitations, root canals, bridges, nutrition health, mercury, fluoride. We hit like a ton of great topics. So we'll make sure this show is archived. There'll be a full transcription of this and all the links will be below. So if you're listening and you're like, oh man, I want to reach out to Dr. Joan, don't worry. Click below in the description. You'll see all of the links below. And Dr. Joan, thank you so much for coming on the show. We look forward to having you back for a round 2 soon.
Sounds great. Thanks for having me.
Thanks so much.
Bye.
Got a question for Dr. J? Go to beyondwellnessradio.com and click the questions button. Then tune in to hear the answer. Also, if you like the show, click below to review us on iTunes. For more Beyond Wellness Radio, go to beyondwellnessradio.com.